What causes delays in cluster headache diagnosis? Imagine experiencing intense pain around your that hits suddenly and lasts for a while. Now, picture trying to explain this to a doctor who might not immediately understand what's happening. That's often how diagnosing cluster headaches begins. These headaches are quite distinct but can be tricky to identify quickly. The main reason for delays is that they often look like other common headaches or health issues. For example, the pain from a cluster headache is usually one-sided and very severe, with symptoms like swollen eyelids, watery eyes, or nasal congestion. These signs can resemble migraines, sinus infections, or even dental problems. When doctors see these overlapping symptoms, they might think it's something else first. Another factor is that many healthcare providers are not very familiar with cluster headaches because they are quite rare. Some doctors might see only a few cases in their entire career. This lack of experience means they might not recognize the pattern right away. Patients often wait years before getting the correct diagnosis. Studies show it can take about 5 years from when symptoms first appear to when someone is properly diagnosed. Sometimes, the first doctor visit results in a misdiagnosis of migraine or sinusitis, which leads to ineffective treatments. The way attacks happen can also cause confusion. Some people have attacks that last only 15 minutes, while others have episodes that go on 4 hours. The cyclical nature of these headaches, which can happen in bursts during certain seasons or at specific times of day, may not be obvious at first. If a patient does not keep a detailed record of their attacks, it becomes harder for doctors to see the pattern. Without clear information about when and how often the attacks happen, diagnosis can be delayed. Diagnostic tools like specific questionnaires or headache diaries are helpful but are not always used. If a patient does not mention key symptoms or forgets to track their attacks, it can slow down the process. Also, distinguishing between episodic and chronic cluster headaches adds another layer of complexity. Episodic means the attacks come and go with remission periods, while chronic means they stick around without breaks. Recognizing these differences early can be tough, especially if the patient's history is incomplete. To reduce delays, it's important for doctors to be aware of the unique features of cluster headaches. Patients should try to keep detailed records of their symptoms, including attack times, duration, and associated signs. Using targeted questions can help differentiate cluster headaches from migraines or sinus issues. Early diagnosis allows for quicker treatment with options like oxygen therapy or medications that can prevent attacks. Overall, the key is better education for both healthcare providers and patients so that these severe headaches are identified faster and managed more effectively.